Hi everybody, my name is Lauren and this is my portfolio video for Nursing 701. So the topic for my portfolio is GERD, or also known as gastroesophageal reflux disease. So the acronym for GERD is GERD, again, gastroesophageal reflux disease. So to start, I want to talk about what GERD is and the definition of GERD. So with our esophagus, that is the tube that carries our food that we've chewed up and swallowed down into our stomach. The tube that food moves down into to make it to the stomach is the esophagus. So when GERD happens, it's when any stomach acid or bile actually backflows up into the esophagus again, which again is the tube that brought it down from the mouth into the stomach. So the GERD and acid reflux occur when there's some backflow, allowing that acid back up into the esophagus. So GERD, it can happen, but it actually only becomes a problem when there is damage done to the esophagus. So it could happen to people, but they don't know it's occurring because they're asymptomatic or because there's not been damage done to the esophagus. So when damage is done, that's when people start to become symptomatic with the symptoms of GERD, which I'll get into shortly. GERD can be chronic. People, even without eating triggering foods, which is another topic I'll get into, they could still just have chronic GERD and chronic of that backflow of the stomach acid up into the esophagus. Symptoms of GERD include chest pain that can normally be described as like a burning sensation, epigastric or abdominal pain, trouble swallowing, feeling like your food is gonna come back up, coughing, vomiting, feeling like there's a lump in your throat. Sometimes you can have black stools from GERD even. So those are the main symptoms that you'll see when it comes to GERD. Next, I will show a picture during the video, and this is how GERD occurs. So this slide says acid reflux, which is again the same thing as GERD. It can be referred to acid reflux or heartburn. So this image is showing a healthy stomach where there's a lower esophageal sphincter that's getting closed off, allowing that stomach acid and bile to remain in the stomach. We're then seeing the diagram where it's showing, it says GERD stomach, where we're seeing the lower esophageal sphincter is open and not working appropriately and allowing that acid reflux back up into that esophagus area. So that's just a visual of how that's happening. Again, more GERD symptoms. I have a visual here as well. Nausea, hiccuping, you can some weight loss and like a chronic sore throat, a harsh voice. So again, just some more symptoms of GERD. Causes of GERD. So again, at the beginning I mentioned that it can become a chronic issue for people. And in that case, they would take medicine to control that. However, if it's not a chronic issue for some, there can be triggering things that would trigger GERD symptoms. A large meal, a large fatty meal, fried food, carbonated beverages, spicy foods, and then at-risk populations for GERD symptoms are obese people as well as those that smoke. For example, I did have a patient the other day who has a history of chronic GERD. I was asking him how his symptoms were. He was taking a PPI daily, which again, I'll get into what that means here shortly. However, he was taking medication for GERD symptoms, but he said every time he has marinara sauce, red sauce, salsa, things like that, that have that more, tomato and acidity component to it, he always has worse GERD. So again, with people, that's kind of something you have to watch, what triggers those symptoms for some, because it can be managed if they know what kind of foods trigger those symptoms. Next, I'm going to get into, now I'm going to talk about what medication can be used to control GERD symptoms, and that is called a PPI or a proton pump inhibitor. And the mechanism of action for these PPIs is that the medication actually blocks gastric acid secretion by binding to and inhibiting those gastric producing cells called the hydrogen potassium ATPase. So those cells are the ones that are going to produce the gastric acid, so the PPIs are able to bind to that and inhibit that action, so therefore preventing those GERD symptoms. Some examples of GERD medications that you've probably heard include omeprazole or Prilosec, eomeprazole or Nexium or lansoprazole or Prevacid. All of those you can actually buy over the counter. You actually, for some PPIs, they require a prescription, such as pantoprazole, which is Protonix. So just keep that in mind. You are able to buy some stuff over the counter if needed. Moving on, I'm going to discuss 5 different research articles that I did research that regarding GERD and different studies that were done on people and seeing how they're able to prevent GERD based off certain things such as diet or how GERD is affected by in the pediatric population with ongoing stomach issues. So just some interesting studies like that, which I'm going to get into. My first article was called Trends in PPI Use, Reflux Esophagitis, and Various Upper GI Symptoms. So this was a research questionnaire looking, and all the participants did have symptoms of GERD. It took place actually in Japan during the years of 2010 to 2019. Participants were actually quite a bunch. It was 223,793 participants for the study over that 9-year period. The outcomes of the study looked at how those that use a proton pump inhibitor medication, if their GERD symptoms overall decreased or increased. And it showed that PPI rate usage increased during that 10-year period, along with GERD symptoms increasing during that time. However, using the PPI medication did decrease people's symptoms. So that is study number 1. For my research study number 2, this is called Elimination of Dietary Triggers and is Successful in Treating Symptoms of GERD. So this was a questionnaire study that took place March through October of 2019. There were 110 participants, and they all presented with GERD symptoms. The purpose of the study was to eliminate the GERD-causing foods that the participant thought was causing their symptoms. So removed all possible GERD-causing foods, and then followed up 2 weeks after that food elimination, where they did the questionnaire over again. It was the same questionnaire that they were initially given. That study showed that 85% of that participants had at least one GERD triggering food. So they were able to narrow down the foods that were causing their symptoms. And I kind of touched on that a little bit regarding trigger foods. So that's something to keep in mind if suffering from GERD. For my third study, it is called Adherence to Predominantly Mediterranean Diet, Decreasing the Risk of GERD, a cross-sectional study in a southeastern European population. So this took place in Albania and was a population-based cross-sectional study. There were a total of 817 participants. Both men and women were included with this. And then they were all randomly selected through a physician's list of patients that presented with GERD symptoms. So it's looking at wanting to see how patients eating a Mediterranean diet versus a non-Mediterranean diet show symptoms of GERD, and if there's a difference with it. So a Mediterranean diet includes, again, it's kind of seen in that Eastern European area, such as Albania. With those, you're going to see plant-based foods, whole grains, a lot of vegetables, legumes, fruits, nuts, seeds, herbs, and spices. That's kind of what was classified as a Mediterranean diet. So with this study, 445 people ate a Mediterranean diet, and then 372 of those total participants ate a non-Mediterranean diet. The study showed the results that those that participated in eating that Mediterranean diet then overall had less GERD symptoms. For the fourth study that I looked at, this is called Pain and Internalizing Symptoms in Youth with GI Conditions, including recurrent abdominal pain, eosinophilic esophagitis, and GERD. So this is a cross-sectional design that took place with the pediatric population actually. So there are questionnaires that went along with the study that were done by the patient caregivers. Again, because it was the pediatric population. So this questionnaire looked at pediatric pain, anxiety, depression, and quality of life. It took place in the USA. There were 133 participants, all with one of those 3 GI issues that I mentioned, the recurrent abdominal pain, eosinophilic esophagitis, and GERD. So I was looking at GERD predominantly, looking at the main participants, which are an average age of 11 years old. These patients were in need of an endoscopy procedure, such as the EGD, which stands for esophagogastrogrudonostoscopy. So again, that's a scope where they go down the esophagus and look at the stomach and things like that. So this study, after this procedure was done, the study gave the questionnaire to the participants' caregivers, and it actually showed that the impact of pain there was an impact of pain, increased pain and increased psychological needs of patients that actually had these chronic GI conditions as the pediatric age. So I thought that was really quite interesting that it had quite that effect on that young population dealing with these chronic symptoms such as GERD. And our research article number 5 is called How Do Dietitians Treat Symptoms of GERD in Adults? This is a questionnaire study and actually took place in Australia. The data was collected by registered dietitians that were practicing and licensed with the Australian Accredited Practicing Dietitians Organization. So 1,255 questionnaires were returned after being sent out to these dietitians. Only 798 were eligible to be used in the study of those that were sent out the questionnaire. Some declined involvement, of course. However, a total of 699 dietitians' questionnaires were used for this information collection for the study. So the aim of the study was to determine if dietitians have counseled many people in management of GERD symptoms. And the answer is yes, and there's actually 4 lifestyle modifications recommended by these dietitians that are effective in reducing these GERD symptoms. The 4 things that those dietitians recommended is kind of an umbrella of lifestyle changes. So overall, just a better diet, increase in water intake, interventions such as sitting straight up for an hour after food, and then just avoiding those trigger things are kind of the main things that those dietitians recommended when treating patients with GERD, along with, again, unfortunately, kind of like that Mediterranean diet that we touched on earlier, plant-based, bland, fruits, nuts, seeds, things like that, to prevent those GERD symptoms. And that will conclude the video on GERD for my portfolio project, going over those kind of basics of GERD and how we can manage it, as well as the 5 research studies that I researched. I hope everybody has happy holidays and best of luck. Thank you.